5 types of hepatitis: A, B, C, D, and E. Now, Uganda mostly suffers with hepatitis E and hepatitis B. What the Ministry of Health calls formidable in the country, however, is hepatitis B. There is need to worry because now this is a disease that is competing with HIV. And away from the two being spread in the same manner, treatment for both is similar.
Yes, it has been scientifically proven that antiretroviral drugs can control hepatitis B and C, but not treat it and heal it completely.
They are selected ARV depending on the type of hepatitis. I would like to mention this. Now, because of panic, anybody who is tested positive rushes for ARV. It is wrong.
Just like HIV, the ARVs can reduce the virus load of hepatitis B and C, but for any country to begin treatment, WHO guidelines have to be followed. Uganda doesn't yet have these for type B. Only those for type C were given.
Hepatitis C is not a big problem here, but with time it will become.
In Africa, specifically in Egypt, it kills about 40,000 Egyptians each year, according to WHO. With type B, annually they kill more than 1 million people globally.
To date, we have drugs for those who are HIV positive.
Unless someone is co-infected with either type of virus plus HIV, then they can be enrolled on HIV drugs.
For the hepatitis A and E, they clear. You have 100% recovery.
Any kind of treatment offered to these only makes them non-infectious, but not cured. Chronic hepatitis B is what Kenneth Kabagambe has, and it feels like it is being neglected.
The health worker who diagnosed me didn't know what to tell me, so they referred me for ARVs in the first place. So I swallowed ARVs for one full month, but ignorantly. Until he met a doctor who told him that he needed no treatment. Kabagambe, who is also the director for the National Organization for People Living with Hepatitis B, says that patients spend a lot on evaluation.
The test costs about 200 to 300,000, but soon we are going to have at least one facility for doing viral load.
Meanwhile, hepatitis B continues to manifest itself in the country.
10% or more than 3 million Ugandans are living with the chronic hepatitis B infection.
Most of the causes, however, are preventable.
Frequent hand washing with clean water, use of appropriate sanitation facilities, eating well-cooked food, drinking boiled water, promotion of safe sexual practices, and avoiding sharing of skin-perceiving devices, as well as vaccination.
Sadly, many will not know if they have hepatitis B because, like HIV, some fear to get tested, yet they could unknowingly infect others. Florence Naluyimba, NTV.